The United States' government is ramping up its efforts to contain the coronavirus after troubling new signs that the virus is spreading. Health officials in Washington state say a second person has died, and the number of confirmed cases in King County has risen to 10. Governor Jay Inslee has declared a state of emergency in response. In Florida, Governor Ron DeSantis has declared a public health emergency after two people tested presumptively positive for the virus, meaning they have been tested positive by a public health laboratory. But the results are pending confirmation by the CDC. And in New York, Governor Andrew Cuomo has confirmed the first case of coronavirus in New York City. The woman in her late 30s contracted the virus while traveling in Iran. In response to the global increase in confirmed cases, the Trump administration announced on Saturday that it would extend an existing travel ban on Iran. It will apply to any foreign nationals who've been to that country over the past 14 days. The State Department is also increasing its warning, advising Americans not to travel to Italy and South Korea. Joining us now, a virus expert and outbreak responder, Dr. Joseph Fair. He's an MSNBC medical contributor and former White House advisor for health policy under President Obama, Dr. Ezekiel Emanuel. He is vice provost for global initiatives at the University of Pennsylvania and the author of the new book entitled The $1 Trillion Revolution: How the Affordable Care Act Transformed Politics, Law, and Healthcare in America. We'll get to that in a moment. But first, the coronavirus.
Yeah, Dr. Fair, what are we looking at right now with the outbreak, obviously, in several states? What exactly is happening right now? Are we just finally having people taking tests and finally getting positive tests? Do you suspect this is already far more widespread than we know?
Absolutely, I do. I mean, overnight, we've seen the cases go from 2 states to 7 states. And it's all about the diagnostic testing. Until we have those diagnostic tests rolled out broadly, which they are coming out now, as you heard from Florida, those were tested by public health laboratories. And the way that lab systems work is you'll have a presumptive positive, meaning the public health laboratory has tested it, it came out positive. It will then be confirmed positive by a second test by the CDC. So what we're seeing is expected. We do expect it to spread throughout the United States, undoubtedly.
So people waking up this morning in Florida, Texas, Nebraska, Illinois, these other states that are just last week, we're hearing the president say we haven't had an outbreak, haven't had anybody die in the United States of coronavirus. That's happened now. Obviously, this is not the time to panic. But what are they to do with this information?
Really, it comes down to individual personal responsibility for your hygiene. You are your own best defense. So hand washing, using tissues to, push elevator buttons, hold on to handrails, etc. I really recommend going against masks just because most people use them incorrectly, and the type of masks that are widely available on the market are not effective in preventing this virus.
So again, Mika, we're talking basics, washing your hands. Obviously, if you're coughing, covering your mouth coughing. But as the doctor said, even when you're pushing elevator buttons, rails, always have something between you and that object. So,
Zeke, we want to ask you, first of all, about testing across the country. Is it happening? Is it available? How long till certain areas get the tests? Because I guess I would predict there would be an increase in numbers when that testing gets there. But what is the process right now in terms of how prepared localities are for testing for this virus?
Well, we're ramping up, and we're ramping up across the country. And the increased numbers that you see are a reflection of increased testing. And that's we're going to see double and triple overnight numbers as we test more people. And as we sort of get to the South Korea level of 10,000 people being tested a day. But it's also an interesting question. Who do you test? Especially because you can certainly test people who you suspect who have shortness of breath, fever, and other symptoms of coronavirus. But we also know that lots of people are asymptomatic. They think they have a cold, not anything more serious. And the question is, what level of suspicion do you have to test? We need a prevalence survey. How prevalent is it in the community? And how many people have symptoms? How many people have severe symptoms? And that we don't know yet. But I would not be surprised to see this go well over certainly 1,000 before the end of the week. And I think, we are going to see people respond to that. There's a lot of fear. I'm already at the University of Pennsylvania and in other scenarios, people saying, because of an abundance of caution, I'm canceling this trip or I'm not going to be there. And I think you're going to see a lot more of that kind of behavior because of the uncertainty.
Yeah, we're seeing that as well. But Zeke, when you talk about the testing, we're ramping up. I'd like to know more about what that means exactly, because, for example, there's 2 cases brewing in the news in Florida, for example, in an area where I think there might be testing. But how does testing get to all areas? How long will that ramp up take?
To be honest with Mika, I don't know how long it'll take. We should have had this ready. South Korea shows you can have it ready. There have been multiple complications at the CDC, the latest report being that there was contamination, maybe in the test kits that they were developing. And that's, all of that is a real concern, because if you can't test, you don't know how this virus is really spreading and how much in the community it is. And as you've pointed out, some of it is coming in from outside. But I think the big spread in the country now is going to be from internal spread, people who have the coronavirus and don't know it and are spreading it to others. Right. And that's going to be our most serious threat. Like terrorism, it's not really coming from the outside. And unfortunately, we did not do a good job. The administration didn't do a good job of, when it delayed people coming back from China, bought some time, a few weeks, in prepping for the eventuality that it would be here. I think they were hoping it wasn't going to come, that just shutting the borders would be enough. That is clearly never enough for a virus, and they were warned about that.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.